G'day guys, Jeremy from TACMed Australia. Today I'm going to show you the defibrillator that I carry in my car. So a few months ago we decided those of us with work cars, we should probably carry a defibrillator, seeing as though we teach them, we sell them, and obviously love them because they work. So we're carrying the HeartSign Samaritan 500P. It's a biphasic defibrillator. It's pretty compact, and obviously it's just really easy to use. So I'm not actually going to talk about the defibrillator too much in this video, but what I will sort of talk about is some of the things that I carry with that defibrillator, the accessories in the back. Now I've just really got them stuffed in here, so be prepared for a gear explosion, but these are some of the things I carry. So I'll just run through what I carry with the defibrillator and why I carry it. In no particular order, and I'll just start from the top. I just carry a 20x20 combine. You know, not uncommon for when someone has an arrest or something, they'll collapse and have a laceration somewhere. Alternatively, if they've been swimming at the beach, pool, river or creek, certainly where we are in Coffs Harbour, I can just give them a bit of a wipe down and dry their chest if they're really sweaty or wet from something. So got that there. On that topic, I've got a razor for those patients that have got really hairy chests. Obviously we want to have really good contact between the defibrillator pad and the patient's skin. One, so that the defibrillator can read it correctly, read their rhythm or lack thereof. If you don't, if they're really hairy and you've got a gap between the patient's skin and the pad, when you start defibrillating, you'll smell the very distinctive smell of hair, singed hair burning. Next, I've just got two oropharyngeal airways to help with airway management, and I've also got a size 7.5 naso with lube there as well to help. So just a bit of airway gear. Obviously I carry a set of trauma shears so you can access the patient's chest when you want to cut through that clothing. So I just got a small set of 5.5 inch trauma shears there. I've got a North American Rescue survival wrap emergency blanket. Two reasons. One, if we get output later, I'm going to keep my patient warm. But secondly, cardiac arrest can be really messy, especially if they've just had something to eat. Maybe someone was doing ineffective ventilations prior to you arriving and has filled their stomach full of air. They can purge and there can be vomit everywhere. So alternatively, I can just open this up and lay it on the ground so I can keep myself nice and clean from vomit or anything else nasty on the ground. So, obviously, it's a couple of sets of nitrile gloves just for PPE there. And just lastly, I just carry a pocket BVM resuscitator. I've shown these in a few other videos, but it's a full-size resuscitator so we can ventilate our patients. I'm not sure about you, but I'm not real keen on doing mouth to mouth, so I've just got the mask. We open this up, hook it up, and we can ventilate our patient. So that's just some of the things that I carry. That's just some of the things I carry in the rear compartment of the only last thing I've got in there is just the instructions. If you're using that during an arrest day, you've got some questions to ask yourself. So that's just what I carry just in the back compartment of the Samaritan 500P HeartSign defibrillator. Alright guys, hope you enjoyed that. So these are the defibrillators we carry in our TACMed cars and just some of the things that go with them. If you carry something else, make a comment and let us know. Thanks for watching.